4 considerations to keep in mind when you are writing patient education materials or advertising materials on prescription drugs or medical device. These 4 general considerations come from a 27-page FDA industry guide on presenting risk information in prescription drugs and medical device. So, first consideration, present the risks and benefits in a consistent language that is understandable by the target audience. So when you are writing a consumer-directed ads, you speak in a consumer-friendly language. You present the side effects or adverse reactions in a way that consumers can understand. You don't use the same language that you would use to talk to or write for healthcare professionals. Also, maintain the consistency of the language for the benefits and the risks. That means that you cannot explain the benefits in simpler words and let the risks be in words that consumer cannot understand. So use the same consistency of language to present risks and benefits so that there is a balance, patient gets information on both, and also HCPs and consumers, they're clear about what these drugs bring. General consideration number 2, use consistent signals across benefits and risks. So if you are using a shiny headline before you present the benefit, you also have to use a shiny headline before you are talking about the risks. General consideration number 3, frame risk information in the same terms or with the same degree of specificity as benefit information. So if you are talking about the brand name, you are taking the name of the drug itself to talk about the benefit. You also name the drug when you are talking about the risk. You don't use the generic name and give patient the impression that, oh, it's not only this drug, every drug in this category have this risk information. You use either generic name for both, if that's suitable, or you use the brand name and be specific and maintain the same term and degree of specificity to present both risk and benefit information. And general consideration number 4 and the last one is that focus on the order of information so it's not misleading. Sometimes you are giving a patient or HCP consumer one information and the next information they are close to each other, side by side together, they can mislead the patients. For example, when you're saying patients shouldn't drink alcohol when taking brand X, common side effects are drowsiness and nausea. What does it mean? Does it mean that if you are taking the brand or the drug with alcohol, that's when you will get the drowsiness or nausea? Or it means that you cannot take them in the same day? Or does it mean that common side effects are drowsiness and nausea? It's a separate statement. If you're a medical writer or copywriter, applying these 4 considerations will improve your copy tremendously. Are there considerations that you keep in mind when you write patient copies or when you work on prescription drugs and device promotions? Let me know in the comment box.